Hi, my name is Dr. Ken Richter. I am a primary care physician at Scotland Family Medicine. When I started my practice in 1989, most family medical practices were independent and focused their energy and time on the patient. Now, over the years, there have been major changes in primary care. The independent physician, which was common years ago, has now been replaced by physicians and practitioners who are employees of large hospital and healthcare systems. The insurance industry, which was mainly directed at inpatient care, has assumed a larger role in governing outpatient care and determines what is approved for payment. I discovered direct primary care around 2012 and was intrigued at the prospect of seeing patients without worrying about insurance coverage and insurance pre-authorizations and approval. Instead of relying on billing the insurance company, we only needed a monthly membership fee from the patient to be able to provide primary care services. I also understood that my independence from a hospital employer was giving freedom to my patients so that we could discuss treatments that are profitable for the patient's health rather than financially profitable for the hospital system. I was hearing stories from patients that were telling me that they could not get refills for medications without an appointment and then having to wait 2 to 3 weeks for an appointment with their family physician. Patients were telling me that when they called for an acute care issue like a cold or sinus infection or rash, they were not able to get an appointment with the insurance-based fee-for-service family physician, and they were forced to go to an urgent care center or emergency room, which obviously was a major cost. I was hearing that their physician visit was only treating and listening about one problem per visit rather than looking at their whole concerns. Of course that happens, because the physician would spend 3 to 5 minutes for the visit and then 12 minutes for documentation in order to get paid. Just enough time to write for more tests and prescriptions. Unnecessary office visits were becoming the norm. Lack of access was common. Over-testing and over-treating was increasing in frequency. There was no option for telemedicine or virtual visits. There was no discounts in pricing or options other than that hospital system. Patients were spending more and receiving less. Did you know that your hospital-based physician is financially rewarded or punished based on how many tests are ordered and how many consults are arranged? How unbiased can that be when a test is ordered? There is this understanding that there is no financial harm by ordering these tests and treatments because my insurance will cover this, right? Well, once you meet your deductible, which is your out-of-pocket expense before your insurance kicks in, then the insurance company still has the right to refuse any other testing for a multitude of reasons. And you are once again prevailed upon to pay these costs out of pocket. And you get charged the retail highest cost for those tests or treatments. If you're pleased with your present care and this is not your experience, then great. There's no need for change. But if you have experienced any of the frustrations with the current healthcare system, I'm here to tell you about the great news about direct primary care. With your monthly membership, your office visits are complimentary. But many times you will not need to go through the hassle of coming to our office in order to get care. Each of our patients get an app to use with their computer or smartphone where they will have direct link to my office. You can text in your symptoms for advice and treatment. You can send a photo of a rash or a sore throat or a document that needs completed. You can arrange for a virtual visit and save the time, gas cost, and hassle of an office visit and still get care. That's right, because we do not participate with insurance, we can take care of your needs without an office visit. If your condition requires a physical visit for evaluation and treatment, it's complimentary with your membership, and we will make arrangements for you in a timely fashion. We plan on enough time to cover all of your concerns at that visit. Routine visits are usually 20 to 30 minutes in length. If you need a routine test like a urinalysis or EKG, we can do that right in the office at no out-of-pocket extra cost to you. Procedures like cryotherapy, minor surgery, or injections can be done with no out-of-pocket cost as well. Because of the incorporation and consolidation of healthcare by insurance companies and hospital systems, physicians and healthcare providers are no longer answerable to the patient. The doctors are employees of a bigger system, which looks at one bottom line, and that is financial profit. We all know it and feel it when our healthcare becomes impersonal and we feel like we're just one piece in a very, very big machine. That system is rewarded for disease management and not disease prevention or building optimal health. Think about the current system. It is rewarded for illness. The sicker you are and the more dependent you are with health care, the more you will spend for visits and medicines and treatments. Why would there be any financial incentive to keep you healthy? Direct primary care looks to build optimal health and works to fix the condition rather than treat the symptoms. Most of these repairs are done with guided lifestyle changes and non-pharmaceutical options. Direct primary care has the direct relationship with you. There's no insurance or hospital system that can interfere or prevent us from giving you what you need. Many people ask, if I already have insurance, why would I need to pay a monthly fee for a membership? What good is outpatient insurance if you can't get access to your provider? It is like having a prepaid pass to the movies. But the theater is always sold out, and then you don't get a choice of what movie you want to see. We encourage patients to have insurance to cover the truly expensive part of healthcare: inpatient hospitalizations, surgeries, and procedures. Those expenses can realistically bankrupt you in a very short stay. We hear people say, well, I already have a physician that I've had for many years, and I don't want to change. If your experience continues to be good and of good value to you and your family, then of course we want you to stay with that practice. But the unique quality of direct primary care is that we can be your backup. In case your family physician cannot see you for an office visit, we can provide the virtual care through a text or conversation. You can have refills without being made to come into an office visit. You can have access to discounted medications, labs, and imaging. We can partner with your family doctor so that you can have a team that will increase your access. When I started my direct primary care practice in 2014, there were only another 150 practices in the country doing what I was doing. Now there are over 2,000 practitioners who have chosen a different path and will never look back and have loved being a doctor again. The freedom of care without the confines of a broken insurance system or a profit-driven hospital monopoly can be felt with your DPC experience. We would welcome you to try DPC. It truly can save your life. Thank you.